Hi, I'm Dr. Richard Jermyn, Dean of the Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, our podcast series dedicated to highlighting the thought leaders who are advancing the mission of our medical school. Our mission is to foster innovation, elevate excellence in education, and advance transformative healthcare practices. Today, we're thrilled to have Dr. David DeFilippo, founding program director for the Rowan-Virtua School of Osteopathic Medicine Physician Assistant Program. David holds a Doctor of Health Sciences from Nova Southeastern University, a Master's in Physician Assistant Studies from Philadelphia College of Osteopathic Medicine, and an MBA from Temple University. He is passionate about global health and has organized medical missions with the Philadelphia-based Foundation of International Medical Relief of Children. Previously, he was involved in research focused on integrating medicine-assisted treatment for opiate use disorder into physician assistant education. Wow, and what a benefit to have you here, Dr. DeFilippo. And I just want our audience to know, we started this program, put out a search for the director, and you show up amazingly qualified, have done this before, but your mission is our mission. Right?
Yes.
And as we talked about, we're now global. You believe in the global health. And as you know, so much of our research here on medicine-assisted treatment for opiate use disorder, there was nowhere else for you to be. So I just want to, again, welcome you. Thank you for the work you do. And let's just go ahead and get into it. Tell me about what is your vision? What are we going to build here in your PA program?
Yeah, thank you for having me, Dean Jermyn. I really appreciate you taking the time to meet with me and to mentor and start this program with us. It's been an absolute blast getting this program off the ground. I'm really excited about this program. It's a great opportunity for South Jersey, for Rowan University, for the Virtual Health College here. We will be one of the first PA programs here in South Jersey, driving the experience in healthcare education is very integral for our mission. We plan to have a very robust and rigorous academic program, and partnering with the Rowan School of Osteopathic Medicine is going to be very much part of that mission. We have a vision to create a dynamic PA program and curriculum and to entice students from the South Jersey area to stay in South Jersey, to work in South Jersey, to work alongside future physicians that are going to be graduating from the School of Osteopathic Medicine, to work alongside in a team-based environment with other allied health professionals, to have a commitment to interprofessional education. And like you said, I do have that passion for global health, and I'd like to expand upon that while here.
We're going to do this together.
Yeah, thank
Dr.
you.
Dr. I promise you on that. So, I've learned so much, in working with you over the last few months, and you keep reminding me you hadn't even been here a year yet.
No.
It's almost getting there.
It's close. Yeah.
But I've learned so much about the profession. I've gained so much respect for the profession, the amount of training that's needed and the rigor that's involved in that your students will be going through, to me is almost mind-boggling. So having said that, in the environment that we're at today, in this healthcare arena, what are some of the challenges that you're really facing as you're starting this, as you said a few minutes ago, the only PA program here in South Jersey?
Yes, that's right. One of the biggest challenges that we're going to have to tackle is balancing the accreditation needs for the PA program with that of a dynamic student-focused curriculum. And one of the ways that we can really focus in on that and to address that challenge is to have a comprehensive plan for assessments, looking at student feedback, faculty, staff, clinical partner feedback, and incorporating that into the planning and development of this program. It's really an integral piece to make sure that our program continues to grow and continues to develop, but while also meeting those needs from an accreditation standpoint.
You know, you're aware of this, and we've just sort of announced this, that I believe curriculum is always evolving, and it's not something you just look at in every 5 years, and we're actually heading into a curricular renewal process at the medical school. Comes at a really good time. And one of the big, I wouldn't say challenges, but challenges in a good way, is innovation.
Yes.
And what are some innovative ideas you have for your curriculum?
Yeah, that's a really good point. And we are very excited on the Seoul campus. We're actually, Rowan University is building an addition to the School of Medicine there. We're going to have a brand new state-of-the-art simulation lab, a brand new anatomy lab. That'll be a huge boost to our program and for the School of Medicine and for those others that are using it on the RCSJ campus. From an innovation standpoint, I'm a big proponent of the authentic learning model, and that's basically encouraging a practical aspect to teaching and bringing in the real world experiences of myself and my other faculty and the clinicians of the School of Medicine to the students. And I think students really respond well to that. From another innovative point, I'm very passionate about simulation, as I know you are as well.
Absolutely.
And so I think there's a lot of opportunity there, from not only from a teaching and learning aspect, but also from an interprofessional aspect. I think that it's really integral that we start that from the ground level and to build that into the curriculum so that our students get that experience.
One of the comments I get frequently is, why does a medical school need or want to have a PA school? And for me, it's a very simple answer, right? Because we are teams, and I think the future of medicine, the way I see it, is putting the right teams together, and the center of that are our patient. So any thoughts on, you mentioned interprofessional education. I'm going to push a little bit on both you and our medical school deans too, on interprofessional curriculum. And by the way, we have a School of Nursing too.
Yes,
Any thoughts
absolutely.
on that?
Yeah, no, I share many thoughts on that. I'm a big proponent of IPE, interprofessional education, in our curriculum. And I'm very excited about those opportunities, not only working with students and faculty here in the School of Medicine, but also the nursing program like you mentioned, but also other allied health professional training programs in the region. As you mentioned again, PAs are team-based healthcare practitioners. We are dependent practitioners, clinicians. We cannot practice medicine without our supervising physicians. So we are inherently a part of the healthcare team. We don't exist without you as physicians or as other supervising physicians. So that's a key distinction, I think, and something that everyone needs to remember, that we're not here to take other jobs, or we're not here to overstep our scope. We're here to be a part of that healthcare team to deliver care to patients, and especially those in underserved areas, like here in South Jersey.
I thank you for that. I think, I'm a big believer, and you've heard me say this before. In fact, the first time we met, mission to me is everything,
Yes.
right? You have to know who you are. I'm a big believer that if you live your mission, right, and ours is to treat the underserved and to bring providers here, right, that want to treat the underserved from diverse backgrounds. And we would like to see the providers of the future look like the patients and culturally be part of the patients they're serving.
Yes.
To me, that's critical.
Yes.
And I also believe that's our survival. And I think in doing that, in knowing who you are, it's allowed us to even almost triple our research enterprise. And I got recent data, and I'm going to share this with you right now, where nationally for medical school, the people applying to medical school has, in the last 5 years, gone down. This year, we have 1,000 more applicants this year than we did last year.
Wow. Wow.
So somehow we are doing something a little bit different.
Yeah.
And I think what we're doing different is we're telling people who we are and why you should be here. So I'm gonna send that back to you, to your future students.
Yes.
Why should they come here?
Yeah, I think that's a great question. And I think what sets us apart, being a part of a university committed to that mission, like you just said, we share that mission, and we're developing that mission here in the PA program. We are part now of the Virtual Health College and working together with our close affiliated partners, ensuring that our students have those rotations in the area and beyond that can meet the needs of the curriculum and for their training to become excellent PAs in the future. I think also having the state-of-the-art innovations, the new sim lab, the new anatomy lab on the Sewell campus, on our CSJ campus, that's huge. That really does set us apart. As you know, like a lot of schools are moving away from that, and I think that'll be another distinguishing factor for our PA program. Having the experienced faculty that we're hiring and have here within the School of Osteopathic Medicine to teach within our program, another huge bonus for our program and for our students. So I can see so many reasons. And then there's a real need for future PAs in this area, as you well know. And so hopefully the PAs that we recruit to our program can stay here and to grow and to work here and love it here as much as I do.
And I'm going to talk to your future students right now.
Yeah.
And I want to say anybody that's applying to the PA school, come here, stay here, also, I'm going to challenge you to go into education because there's no better field to go into, right? So I'm going to challenge you to be part of this dynamically growing new school and part of the university. I'm getting back to mission for a second.
Yeah.
And as I mentioned, you and I had a little conversation. This year is the year we went global, right?
Yes.
Why is that important? I know this is important to you too.
It is.
And why is it important to the school that you're now directing?
Yeah. So one of the most rewarding aspects of my entire career was when I was able to go on a medical mission. As you mentioned, with the Foundation of International Medical Relief of Children, based here in Philadelphia, in the region, and I was able to take PA students with me, and also at one time we also took med students and a dental student with us as well too, and it was truly an opportunity for interprofessional education right there as well, built in, and it was such a rewarding experience, and I hope those students would also say the same. It's helping the underserved, seeing the gratitude, seeing the relief in their eyes, and knowing that we came all that way just to help these folks is really integral and was very powerful for me. The one thing that sets FIMRIC, Foundation of International Medical Relief of Children, apart is that it's a sustainable medical missions, meaning that we don't just fly in and fly out. They're on the ground there 5 days a week, 7 days a week, all year round. And so there's folks there that are working, seeing patients, helping patients in the local communities all year round, but they work best when there's volunteers. And so having students there, having other providers there, clinicians there, is really, really an integral part of their mission. And then it's a great opportunity. It's a great opportunity for our students to develop increased awareness, cultural awareness, experiencing different cultures, seeing how other people live and how healthcare affects other people in different countries and different parts of the world, how healthcare systems are different in those countries and different parts of the world as well too, and the challenges they face. And coming back to PA school with a different perspective and coming back to their future positions, careers, with that perspective in mind. It's a very rewarding experience. I would definitely like to continue that and build upon that here.
We're going to do it, you and I, I'm telling you. And I'm going to say this to your students. Boots on the ground. We're going to have events. You don't have to go far, especially here in South Jersey, to find great need. And we're going to put you in vans. We're going to put you in buses, side by side. in an interdisciplinary way with all the colleagues, and you're going to create a difference coming here to the school. So, Dr. DeFilippo, I just want to thank you so much for taking the time, talking to us, educating our audience here today.
Well, thank you very much. It was my pleasure to be here.
And again, I want to thank our viewers once again for meeting with some of our critical people, as you met today, our new director of our PA school, who help move our mission forward. So thank you. Keep tuning in, and I'll see you next month. Thank you. Bye now.